expanding Medicaid, known as BadgerCare here in Wisconsin. It's something that is long overdue in Wisconsin. Republicans who have controlled the legislature since the Affordable Care Act passed have steadfastly refused to go along with it. Is anything going to be different in this new session now that the Republican majority is thinner than it's been in any recent memory? Up North News reporter Elisabeth Montemurro joins us now to talk about that, because there was a WISP Politics luncheon this week that offered up a bit of a preview about that and other topics. Elisabeth, good morning. How are you?
Good morning, Pat. I'm doing well. How are you?
Good, thanks. So you were listening into the WISP Politics session, which featured Senate President, Republican Mary Felskowski, and Democratic Assembly Leader Greta Neubauer. And so let's start with, I guess we'll start with Medicaid, but, healthcare overall and other affordability issues. Did they play a pretty big role in the back and forth at this luncheon?
That's right. They absolutely did. I think my biggest takeaway was that the underlying topic for everyone is affordability. The two different sides just seem to have differing opinions on how we get there.
Well, no doubt, and it's about more than just the cost of something. There's also what you can do with it, and what I mean by that is Medicaid versus private insurance. So, to give folks a little historical context here, when the Affordable Care Act passed, which included the option for states to get 90% funding by the federal government to expand Medicaid to more people, Scott Walker and the then the Republican-controlled legislature at the time said they're not going to accept that. They will use the Affordable Care Act exchanges to let more lower income people get the subsidies to purchase insurance, but it's private insurance. And so that's where some of the back and forth is on this. And so when Senate President Mary Felskowski was asked about this from a Republican standpoint, did she provide any indication that they might change their direction and embrace expanding Medicaid?
I think maybe a little naively, I was expecting there to be a little bit of wiggle room coming out of the conversation, just given the new landscape and the new maps under which Wisconsinites just voted under in this past election. But it very much seemed to be a non-starter.
She just it's not going to change. And here, let's play a short clip of her explanation of why Republicans are already saying that Medicaid expansion is off the table.
We don't have a gap in Wisconsin, so why would we take people off of private insurance to put them on government insurance and put our hospitals who are already suffering into a worse position with a lower reimbursement rate? We don't need to create more gaps in healthcare when we have people covered.
Right there, you hear in her words the heart of what she's getting at. She talks about taking people off private insurance, which you can get subsidies for under the Affordable Care Act, and putting them on, and she almost sneers when she says it, government insurance. These are the same people that talk about government schools, and but they're happy to drive on government roads, and they're happy when airplanes don't crash because of a government air traffic control system. But that's the way they talk about Medicaid. And I think that Democratic Assembly Leader Greta Neubauer, she took that and it certainly sounded like, hey, I think we should still talk about this. And by the way, there's a reason why you might want to move off of Medicaid or off of private insurance and into Medicaid, right?
That's right. She very much spoke to the fact that this will continue to be a priority for Assembly Democrats, as it has been in recent years. Because it really can help a lot of folks. And while Wisconsin might be in a little bit better shape in terms of the uninsured or less insured compared to other states, there's still people that could really benefit from Medicaid expansion.
Yep, let's give a listen to Representative Neubauer.
On Medicaid expansion, that this, of course, is going to continue to be a priority for us. We know that there are some people who are able to be on private insurance, but it is a huge strain on their families, and they frankly are not able to afford it. They are cutting in other areas in order to afford that insurance that they shouldn't have to, because we should just accept these federal dollars, and we should increase our ability to invest in healthcare, including raising reimbursement rates for hospitals.
So she raises a couple of really salient points here. The first one she notes is that in much the same way Mary Falskowski sneers about government insurance is frankly the sneer you can almost hear in my voice when I talk about getting insurance from for-profit corporations. And what Representative Neubauer is saying is that sure, through the Affordable Care Act, you can get help affording a private insurance plan, but you're still dealing with a private insurance plan, all of the administrative headaches and everything that comes along with it compared to Medicaid. So there's a reason why you would get more stable and affordable coverage through Medicaid. But she also raises the point, and this is an extremely fair point, that while Medicaid does provide more affordable coverage, its reimbursement rate to hospitals is lower than private insurance. And that frankly has been, as big a stumbling block to expanding Medicaid to more families as anything else, Elisabeth.
That's right. And I think the other thing that goes along with this, Pat, is when you've got other folks that are ultimately underinsured, so they might have insurance through a private provider, that coverage is so low that folks end up having to then take on medical debt for basic services.
You know what? Alicia explains this really well on YouTube. She says, when I was on BadgerCare, I didn't have to worry about emergencies and unforeseen medical issues. Now on private insurance, I do. So again, if you can fix the reimbursement rate, and so people are coming at it from different sides. On the one hand, it's let's expand Medicaid and let's get more people covered. And others are saying, well, before we do that, let's get the Medicaid reimbursement rate up from the government to these healthcare institutions. And gosh, wouldn't it be nice if both sides could just agree to do that together? It would, because look, I believe it was the Wisconsin Policy Forum that kind of lays out, there's some real cost savings that's involved here potentially.
That's right. Pat, I believe I did a story on this earlier this fall, that the Wisconsin Policy Forum had a report that came out in August or September that looked at the benefits, or just what does the picture look like when Medicaid is expanded, or if it is expanded in Wisconsin. And there's actually a huge cost savings that the state of Wisconsin could see if we expand Medicaid. When states have opted to expand Medicaid, they initially get a pretty big sign-on bonus. And for Wisconsin, it would equate to an estimated $1.7 billion in over the next 2 years.
Again, that's $1.7 billion that Wisconsin's missing out on by Republicans refusing to accept the Medicaid expansion that could provide this more stable, affordable coverage. That's a nonpartisan report with real dollars and cents behind it.
Right.
Okay.
And that money could easily go to, address the coverage rates and the staffing issues that we are also seeing in, I guess across the board.
Right. Yeah. You could use it for recruiting, retention, training, as well as improving those Medicaid reimbursement rates. Now, also at the forum was Keith Gilkis, a Republican strategist, former chief of staff to Governor Scott Walker. And he kind of, not intentionally, but he kind of throws a grenade into the room by saying, well, this is small potatoes compared to what else could be coming from a Trump Elon Musk administration, which, by the way, begs the question, has anybody seen J.D. Vance? Put him on a milk carton someplace, because right now it's the Trump Musk administration that's coming in. But Keith Gilk is saying, hey, by the way, once they're in, this could all get really crazy. Here's what Keith Gilk has had to say.
It's not just a state program. It's a state and federal partnership. What if under the Trump presidency, and CMS, along with Congress, decided to turn it into a block program. Well, the whole deal that was done under Obamacare with 90% reimbursement by the feds goes out the door. And every state that has adopted that is going to have to revamp the entirety of their program. And so you have a Department of Government Efficiency headed by Elon Musk and Vivek Ramaswamy, and you don't know what's coming out of that, and you don't know what of that is actually going to pass. It could be significant reform in a multitude of different programs. We got to decide whether people are going to renew Obamacare subsidies. That's going to be coming up for a vote as well. I mean, if that completely undermines the entirety of the, healthcare system, we're going to have some bigger conversations than we ever expected in 25 and 26.
So that's Republican strategist Keith Gilkis, and I just want to take the opportunity to say what he just said there is my "I told you so" moment. For all these years that Republicans have said we're not going to accept Medicaid expansion because under Obamacare it's a 90% reimbursement for the states, but that could be pulled away at any time. Well, what I've always said is it's not going to get pulled away so long as there's a Democratic administration. So when Republicans say, oh, that money could get pulled away at any time, as Keith Gilkis just told you, yeah, a Trump administration might pull it away. That's where the real danger is. But all of this is to say, Elisabeth, that for the folks in the room, I'm sure they were as aware as ever that healthcare is going to be a huge discussion point in the legislature and in Congress in the coming session.
That's right. It's just one more point, or I guess one more thing that folks are dealing with when it comes to affordability issues.
Yeah, a lot of affordability issues. Before we go, we're heading into the holiday break. Last we checked, for Thanksgiving, you and your family were making something like 1,000 homemade raviolis. Was that right?
That's right. The day after Thanksgiving, we all get together at my parents' and prepare Christmas dinner while we have a bunch of helping hands, and they will be pulled out of their little frozen beds in the freezer to be dropped into a boiling pot of water for a Christmas feast.
And how many did you make?
I believe we made just over 700 this year.
700. That's got to be, that's a big old vat you got to use for that. You should put a garbage can, a clean one, of course, over a fire like frying a turkey or something. I want to take pictures. We want to see this.
Will do.
This is a great family tradition. Up North News reporter Elisabeth Montemurro, thank you so much. Have a great day.
Thanks, Pat.